As a journalist and producer, I've spent years documenting events, reporting stories, and gathering information to help people get a better understanding of the world around us. This world as I knew it drastically changed 16 years ago when I noticed a lump in my breast. The doctor told me it might be a cancerous tumor. I was forced to reevaluate everything that was familiar to me and to look at the world with new eyes. Hello, my name is Linda Ellerby, and I am a breast cancer survivor. We are cancer survivors from the time we're diagnosed through the remainder of our lives. Speaking as one of the millions of cancer survivors, I'm here to talk with you about many aspects of the cancer experience, the anxiety and fear, as well as the joy we feel every day because we are surviving. Great strides have been made in cancer care, and survivorship is becoming increasingly common, thanks to broad access to patient education materials and most especially effective treatment options, including chemotherapy. More supportive care treatments are now available to reduce some of the side effects of chemotherapy, allowing life to go on while undergoing these potentially life-extending and life-saving therapies. Let's celebrate survival by sharing our stories and try to change the misperceptions many people have about cancer and chemotherapy. I was diagnosed in February of 1992 with stage 2 breast cancer. I had a double mastectomy and underwent 6 months of chemotherapy. I was someone who was used to being in control, but as it does for so many, the diagnosis of cancer made me feel completely out of control. I remember feeling scared, alone, angry, and confused. I kept wondering, why? Many people hear the words, "You have cancer," and they are unable to hear anything else. These 3 little words are frightening, and for some they can be crippling. Your whole world comes crashing down, and at that moment, life as you knew it is altered forever. Cancer is a word that evokes fear for most of us. The truth is, cancer is not always a death sentence. When faced with a cancer diagnosis, it's important to learn about tools that can help you overcome these fears. It's important to become empowered with reliable, evidence-based information. Be your own advocate and gain as much knowledge as you can. Preparation is the key, and when you gain real knowledge, you can be a partner in understanding and choosing options for your treatment. You will be able to make truly informed decisions. No one wants to be diagnosed with cancer and undergo chemotherapy, but the reality is I'm here today because I sought the best known treatment for my breast cancer. In a recent national survey of cancer survivors, 83% said they were at least somewhat fearful before starting chemotherapy. However, after treatment, only 38% felt their fears had been justified. The potential for side effects, such as nausea, vomiting, fatigue, and hair loss, was cited as the #1 fear of chemotherapy, but only 14% actually found it very difficult. 90% of survivors said chemotherapy gave them hope for survival, and 94% would advise other survivors to undergo chemotherapy if their doctor recommends it. Those survivors who had an easier experience with chemotherapy were more likely than those who had a difficult experience to say their doctor tried to ensure they understood their treatment plan before beginning treatment, and that this discussion helped ease their fears about chemotherapy. Let's meet Laurie. 6 years ago, Laurie was diagnosed with stage 4 lung cancer at the age of 42. 3 different doctors told Laurie there was no point to treatment, that she should go home and spend time with her children. Laurie became her own advocate, armed herself with as much information as she could, and found a doctor to pursue an aggressive course of treatment that has kept her alive. Laurie is certainly not representative of stage 4 lung cancer survivors, but her story is inspirational, and she is an example to cancer survivors everywhere.
I'm a nurse, and I've worked in the hospitals my entire life. Was diagnosed with stage 4 lung cancer in 2001, and that came as a complete shock to me. I was absolutely healthy. I had no symptoms whatsoever. I wasn't ill. I didn't have a cough. I felt energetic. I felt absolutely fine. I was told there was basically no need to start treatment. Surgery was not an option for me. I was also told that chemotherapy most likely would not work. Initially, it was devastating. What became very important is the time. If I did nothing, the prognosis would come true. So, you just have to look beyond that. You have to find a focus. You have to set your sights beyond what they're telling you and know that you can get through it. My focus became with my daughters, and I knew I had to become strong enough to get through this and continue to be their mother. They were 10 and 13. And I wasn't ready to give them up. I had seen 3 oncologists and a surgeon who said that there really wasn't any use to start therapy. Surgery was not an option. They basically said, we can't do anything to help you. After doing extensive research, I found a surgeon who initially told me he couldn't do surgery, and then he called back and said, you know what, I'll try. It just ignited my hope. It was just like, okay, yes, I can do this. 4 weeks after my diagnosis, I had surgery to remove my left lower lung. And then after that, I had a short recovery time and started chemotherapy to treat the cancer that was left in my right lung. I've been able to survive this disease partly because I've become my own advocate. I refuse to give up. I've had several recurrences, and each time I go back to the drawing board, figure out what's going to be the best option for me at this time. Chemotherapy matters. And besides having surgery, I was able to participate with chemotherapy. Even though I'm a nurse, I was still fearful about the potential side effects of chemotherapy. But what I found, it wasn't as difficult as what I thought it was going to be. The supportive care drugs that I was given during chemotherapy allowed me to do most everything that I wanted to do while I was on treatment. I took medications to keep the nausea away. I had medications that kept my red blood cells up so my energy levels stayed up. There were days that I felt especially tired, overwhelmed with fatigue at times. On those days, I would plan a rest period. I would plan to lay down before the kids got home from school and take a nap, and that would be enough to get me through the evening activities. I am back to work at the hospital. I'm working in an emergency room. And I still deal with cancer. But I do it as I need to. Lung cancer advocacy has become a passion for me. I want to be able to change the future of lung cancer. I want the statistics for lung cancer to be different for my daughter's generation than it was for my generation. And they're not going to do that unless they have a lot of advocates. We can change the course of the disease. I am a nurse as well as a patient of lung cancer, and I think that gives me a unique role in the advocacy world. I'm an ambassador for the National Lung Cancer Partnership, and I give a patient's perspective on clinical trials in the treatment of lung cancer. I have been given so many more years with my children and my family because of treatment. I've been given the opportunity to be my daughter's mother for another 7 years, and so much has happened in their lives. They were just little girls when I was first diagnosed, and we have gone through boyfriends and first dates and kisses and proms. I think every day is a celebration. After cancer, you just look at life a little bit differently. Things become more colorful. Everything is the most simple things become precious. The memories that you have, sitting in on a rainy Saturday watching a movie, it is not a ruined Saturday anymore. It's an opportunity to spend time with your kids. It's just every day, it needs to be celebrated, every day.
Now I'd like to introduce you to Tom. Tom was diagnosed with advanced prostate cancer 6 years ago. After the initial shock of the diagnosis wore off, Tom and his wife, Ann, learned all that they could about the disease. Tom worked together with his team of doctors to chart a course for survival.
In June of 2001, I was diagnosed with prostate cancer. This diagnosis came about as a result of a visit with my personal physician, who did normal tests because we were leaving for Africa and needed some shots and things. He wrote me a note and told me everything was fine except for my PSA, prostate-specific antigen, was elevated, and to come back and see him after Africa. We went to Africa, had a delightful time, came back, started remodeling our house. I had virtually no symptoms during this whole time, other than possibly a somewhat increased frequency and urgency of urination, which I basically attributed to, the fact I was getting older. When finally I remembered the note from the doctor and went back to see him again. He did another test. My PSA was elevated further. He immediately sent me to a urologist who did further testing and confirmed that it was in fact prostate cancer, that it had left the prostate and had metastasized to various bones and tissue in my body, and at which point he referred me to an oncologist who started me on a course of therapy to treat the cancer. I was terrified. I just wanted to go into a hole and curl up and be gone. I couldn't deal with it. I couldn't talk about it, couldn't even talk about it with my children.
When this came, it was just such a complete shock. He said to me when we walked out of the doctor's office, "I can't fight this. I'm not going to do this." And I just looked at him and I called him a choice name and said, "Don't you ever dare say that to me again. I mean, you have no choice. You're going to fight this with everything you have." We bought every book on cancer that we could find. We weren't going to leave any stones unturned. I went to all the appointments and I kept notes. I kept a notebook and I wrote things down because both the patient and the spouse are very emotional at this time. And you hear different things.
My PSA started rising rapidly again. My oncologist out here recommended chemotherapy. I panicked at the thought of chemotherapy. I was terrified with that. I just envisioned I would be tired and no appetite, lose my hair, these sorts of things. And I'm an active guy. I didn't want that, and I didn't want it for my wife either because she's an active woman. My doctor here was kind enough to provide me a list. He understood how afraid I was. He was kind enough to provide me with a list of patients that had been through this before. And I called 3 of them. They encouraged me and made me comfortable with the process, as did an oncologist that I deal with on the East Coast. I was comfortable with the fact that I might not like it. It may not be the most pleasant thing in the world, but it was an important thing if I'm going to survive and continue to have an active life. So I chose to go ahead with it.
Tom and I tackled this problem together. And it has been a 5-6 year odyssey to find the right lifestyle, the right doctors to deal with this. It has been an incredible journey, but I do feel that because we were together, we will conquer this.
It's important to take control of your care when dealing with cancer. You have to be involved. You have to be invested in what's going on. I got involved in US2 International, which is the world's largest prostate cancer education and support organization. Groups like the National Coalition for Cancer Survivorship or US2 International are organizations that let newly diagnosed patients in particular, let them know that there are others out there in the same position and that they've faced this. And that's really the importance of organizations like this, to let you know that there are others that have walked this path before you. That makes it a whole lot easier to walk the path. Cancer has changed my life. I look at the world differently today than I did before cancer. I spend a lot of time with my grandchildren, which is the greatest joy in the world. If I'd have missed all that because I didn't fight, I'd have been very upset. What a loss it would have been.
Now I would like you to meet Sherry, a 7-year breast cancer survivor. 2 years after her mother faced cancer, Sherry was also diagnosed. She was afraid of how cancer would change her life, but she stayed focused on healing and underwent treatment for a chance at survival. Sherry's positive outlook on life and unselfish giving to other survivors are a truly remarkable contribution to the cancer community.
My journey into the cancer world was about 7 years ago in 2001, and I was diagnosed with breast cancer. And the first course of action was surgery. So I had a lumpectomy, and actually we didn't get all the cancer cells, so the surgeon elected to do another lumpectomy. And finally we ended up doing a mastectomy. So I ended up having those 3 surgeries in 10 days. I was very fearful of chemotherapy, and I think most people are. I knew that having chemotherapy could help, statistically could help my chance of survival. My oncologist is just a great guy, and he really explained a lot to me about the different kinds of chemotherapy. We talked a lot about side effects because I was, again, fearful of those. And he explained to me what the side effects would be, and then also what the supportive care would be to address those, to deal with all that. I really asked a lot of questions. I wanted to take an active part in my treatment, and I knew that asking questions and taking an active role like that was really going to be the best choice for me. I think after my first chemotherapy, it really helped me because then I knew more what to expect. I had heard about the side effects and really didn't know quite what to expect, but had a general idea. I really paid attention to how my body was reacting to it. So I knew that it was beginning to be like a pattern for me. So I would ride that wave and know that I could go ahead and function and do other things on those days that I was feeling well. I think although chemotherapy was a little tough for me, if I were to be diagnosed tomorrow with a reoccurrence, I would definitely look at chemotherapy again because I think it really did increase my chances of survival. And I think I would want to do everything I possibly could to be here. I think everyone has different expectations about their cancer journey, but I think what's key is finding out what works for you. My family and my friends were a huge support system, and I feel so blessed and lucky to have them. You know, it was a little tough for me because I've always been in the position where I'm the giver, I'm the helper. And I had to reverse that role. And at first I was very uncomfortable with it. But then I began to see that, you know what, it helped them to give as much as it did for me to receive. I refused to let that cancer get the best of me. And I think for me, a sense of humor was really important. I lost my hair with chemotherapy. And I would wear funny hats and funny wigs and anything that would make me laugh at myself. Positive thinking just worked wonders. And I would play little mind games. Like, for example, I took sticky notes and put them up on my kitchen wall for every day that I had treatment. So what I would do is at the end of every day, I would take off one of those sticky notes and I would just feel liberated. That was that much closer to being done with chemotherapy. And so it really helped a lot. My journey really inspired me, as it were, to actually help other people cope with their diagnosis and to make treatment a little bit easier for them. In 2003, I formed a nonprofit organization called BAGIT. And what we do with BAGIT is we put together information to help people cope with their diagnosis a bit so they can handle some of those emotions that come forth through their journey. And we help put together some materials that help them kind of encourage them to become a self-advocate. I feel so blessed to be able to do something like that, to give back to the cancer community. I think after going through my journey with cancer, There are a lot of things that are still the same. My family is like the most important thing in my life. My friends are important to me. But I think there are other things that have become more important, and that is enjoying every day. I watch that sun come up over the mountains. There's not a day that goes by that I don't sit outside here with a cup of coffee or a cup of tea and just think that I'm here and that I'm able to do so many things. Each day is a new day for me.
These survivor stories are so inspirational. I would now like to introduce Dr. Skip Burruss of the Sarah Cannon Cancer Center in Nashville, who can provide his perspective on ways patients can cope with cancer and get through their treatment.
As a medical oncologist, my role every day is to help patients fight their cancer. I do a variety of things, from helping them to understand their disease, assist them with their treatment, make sure that they're getting the appropriate support from my staff and from the therapies that are available to make their treatment as comfortable as possible, and yet have the best chance of having long-term survival and possibly even cures from their disease. Many patients, of course, express fear at the diagnosis of cancer, but clearly there's more reason than ever for hope in the treatment of cancer, and I think the outcomes and the outlook for patients continue to improve every day. Our last look at survival data actually comes from 2002. We already had an improvement of 66% in terms of the patients that are surviving their cancer at a 5-year mark. The improvement in survival for cancer patients is due to a variety of things. One, of course, is to try to diagnose cancer at an earlier stage. Secondly, though, is the therapies. Chemotherapy in particular has become more targeted, to use a phrase. We're able to specifically treat individual cancers differently. But in conjunction with that, supportive care, the things we do to help prevent nausea, to help prevent infections, and to keep the patient's blood counts up to avoid transfusions, have all gotten significantly better through the years. And when one thinks about that, in 2002, we're talking about patients that were treated in the late 90s. And in fact, now our therapies are better. We have better supportive care. We have many more treatment options. So there's every reason to think that those numbers are just the first step in what are going to be much better outcomes for cancer patients. And I think more so now than ever in the past, medical oncologists feel like we're right on the cusp of having better therapies to improve outcomes for patients in a variety of different settings. I tell my patients to take an active role in their treatment. I think it's important for them to be their own advocates and to take advantage of their support system, take advantage of their family and their friends and the folks that will help them get through their treatment. I'm there to treat their cancer, but I've also got personnel on staff, my nurses and other team members who are there to help as well. Everyone's an individual. I certainly have never seen 2 cancer patients that look alike, and no 2 ever have the exact same experience. So speak up, ask questions, be involved, be informed, and let us help you have a better experience going through your cancer treatment. As our cancer survivors have just shared with us, the road through chemotherapy may be difficult, but it certainly may be a journey well worth taking.
The feelings expressed by survivors participating in the survey and those we've heard from, Lori, Tom, and Sherry, confirm my own experience. The best route through the cancer journey is to gain as much knowledge as possible so you can be your own advocate and work with your treatment team as an active partner. Chemotherapy's come a long way since I was treated 16 years ago, but if I had to do it all over again, I would not hesitate to undergo chemotherapy once more. I would encourage anyone newly diagnosed to follow their doctor's recommendations. In my journey through cancer, I can't say I loved the scenery along the way, but when I reached my destination and kept going, I was very thankful I took the trip.
Sanofi Aventis has joined forces with the National Coalition for Cancer Survivorship to celebrate the stories of survivors so that people living with cancer can find inspiration when they need it most.